I'm Ellen Cleveland, and I was the budget technician for 25 plus years at the Office for the Aging. So I do know about their finances and the employee structure. So they say they want to eliminate 3 senior outreach worker positions. So, and of the, where's my list? Sorry. Of the 4 senior outreach workers that they have right now, 1 does the high cap. They're the high cap coordinator. So that's your health insurance that you do once every year from October to December. So they go for specific trainings, usually a 2-day training. Jane needs to go. And it's a 2-day training, and then they come back and they train the staff on anything new that's changed. So that's one of the positions they may get rid of, because they're only getting rid of 3, not all 4. The next one is a New York Connects. Oh, and the senior outreach worker for the coordinator of the high cap also carries a caseload. They don't do just health insurance. They also do everything else the agency offers, which Jane's going to talk about. The next one is the New York Connects. Is, again, they're a senior outreach worker. There are certain reports they have to file every single month. If they don't do it, the director does. If you don't have a director, nobody does, then you lose your funding. They don't carry a caseload because under New York Connect's regulations, the New York Connect workers cannot carry a caseload. That is not their type of job. So they don't have any. They take walk-ins, they take phone calls, they see people of any age, doesn't matter because it's New York Connects. It's not really the Office for the Aging, although we get the funding. New York's age group is any age.
0 to death.
Right. Okay, the next one is a senior outreach worker. She does handle a caseload, plus she takes care of the caregiver services. So I took care of my mom for 5 years, which was wonderful because she was only in a nursing home for about 9 months before she had to pass. So what this senior outreach worker did was they helped me get any services I needed for mom. I couldn't be there 24/7. Any services that I need, meals. She could arrange respite care so that I could take a few hours to go play golf or something. And I know that somebody's home taking care of mom while I'm gone. So that's another senior outreach worker position. They also carry just a regular caseload. Everybody who carries a caseload has anywhere from 70 to 80 clients, active clients at one time.
I'm going to interject real quick.
Sure.
The state advocates up to 15 to 20 cases per caseworker. We average that. The state average statewide is about 65. So we are already running above the average, and obviously light years.
Oh, the state loves us. The state loves us.
They love they love the agency. They absolutely
So there,
love
that's
it.
all I wanted to interject.
And the fourth senior outreach worker is the Aging in Place initiative. This is to find services, set up everything so that somebody can stay home, not have to go into a nursing home. Whether they have family members to help them or not, it's so they can stay safely in their home. And again, they carry a caseload. So you're going to take 3 of those 4 outreach. If one of them is not New York Connects, then that means the 70 to 80 clients that they have to go to the outreach workers that are left, who already have 60 to 70. And I'm telling you right now, an outreach worker they're not gonna stop providing services, which is what they said. However, the outreach will not be able to serve as many people. Right. So you may be getting services now where the outreach worker simply can't take a new client to get them set up for in-home services or to get them on meals, because you have to do a whole lot of paperwork to get somebody on meals. It's not income. It's based on your ability to make your own. So, you get rid of those 3 who all have reports they have to submit into the state. So who's going to do all of those? They carry a caseload. 3 of the 4 carry caseloads of 70 to 80 people. Who's going to take care of them? Who's going to take anybody new that comes into the agency? And the agency for this year, the gross cost is $1,855,127.02. Of that, between contributions that we receive from seniors like you that make donations for meals or any services that you get, equals $1,600,951. So for all of the work that agency does, your tax dollars is only $254,176.02. So I'll set this on the table over here for anybody who wants to look at it.
So that's the county contribution, that last number, 215?
Yep,
Okay.
which is of the gross cost of 1.8 million plus, it's allows 13.7%. That's all the county contributes to all the services they provide. So, also, Mr. Blanchard was talking about, they want to go back to the structure that we had 2 years ago. So 2 years ago was for those specific employees that they're talking to get rid of. 2 years ago, there were 14. I'll leave this up there too so you can see it. So in 2 years, it's grown by one position. That's it, just one position. Which is a deputy director. They actually have two in the budget, two deputy directors. But one hasn't been filled for a year and a half. And I wouldn't fill it because it's unnecessary. The second deputy director that they just brought in this year was to take my job, because nobody would take budget technician, which was doing all this stuff and sending all the claims, putting a county budget together, putting a state budget together. It's really a lot of fun. It sounds like a lot of work, but it's an awful lot of fun. So, and I'll put this up there. So that's
Excuse me.
the changes.
Share that around so we all can see that.
Oh, sure,
Thank
I'm
you.
sorry.
Okay.
She was gonna put it on
So
that
this is
table.
what we had, I'm gonna put on the table over there. This is how many in 24, 2 years ago, which is what Blanchard was talking about to take it back. And this is how many there are now. So there's only one more, and that deputy director hasn't been filled for a year and a half, and I can't imagine why they would keep it in the budget anyway. And I'll have this one over on that table.
Thank you.
Does anybody have any questions?
My question I had is, I had asked the supervisors and the county attorney, because the supervisors, my name is Jim, I called all the supervisors, asking them to table this for the past couple of weeks. Now, only four supervisors actually contacted me after my outreach. Now, I had asked them, does the Office of Aging or any department within the county provide an annual report? Where are the metrics? How many clients do those outreach support? And the county attorney says, you gotta file a Freedom of Information request, which I am doing. I also
But you
asked.
can contact the New York State Office for the Aging, because statistical information is sent into them every quarter. I used to do it. And it's submitted every quarter. They will easily give you that information because it's not confidential information.
Well, the
They're not
other,
gonna give
well,
you
my
names.
point exactly with
They're gonna
the
give you
county
numbers.
attorney. The other thing I asked for, could I please have the civil service job descriptions and responsibilities of all the people in the department? Again, FOIL. Okay. So I sent those questions also to the director of the Office on Aging, not knowing that she was on paid leave, then unpaid leave, then fired.
Right.
So that email went anywhere. Didn't go anywhere. So I am processing and following up those FOIL requests because I like to know what the job responsibilities are of those outreach workers. From the supervisors that I did speak with, they said there's senior outreach workers and they don't report, they either have one person reporting to them or nobody reporting to them. So this is the line that the supervisors have been getting from the current administration. So,
Right, which is wrong.
You know, I'll be glad to share the information once I get it, but again, the supervisors were really, they didn't know what the hell they were doing. And, you know, the person, look, I can see if you have a supervisory position and you're not supervising anybody, how did they get there? Is it because of their long tenure? you know, there's all different, everybody's different. And, you know, I had gone through, I have 3 years of budgets for the county, and I went through every line item. I looked at the positions, you know, I know what the salaries are and things like that, but what are their job responsibilities? And like I say, whoever proposes, whether it's the personnel director or whatever, you know, makes sense to have an umbrella organization. That term was brought up before. But as I had addressed on public forums, it took me 3 months to get in to make an appointment when an outreach worker, when I qualified for Medicare. It you know, and my most recent caseworker saved me over $1,000 in medical insurance by going for a different plan. So there definitely is a need, but you don't take money and services out of seniors. And I warned every supervisor that seniors, if anybody, that's the most vocal voter who does vote. So you better listen to us or you're not going to have your job.
And not every senior outreach worker supervises people. The one for New York Connect supervises 2 outreach workers. The senior outreach worker that is the coordinator of health insurance counseling, he doesn't actually, it's not like he supervises anybody, but he trains all of the outreach workers with all of the changes with the health insurance.
Well, one thing I also...
And he's responsible for submitting monthly reports into the state as to how many health insurance counseling sessions they had each month for everybody.
I also asked for current and proposed organizational charts, not only of the Office on Aging, but all county departments. We'll see how that information is forthcoming.
And the Office for Aging does have one because you have to include it in your four-year plan.
Well, like I said, I addressed
So
it.
it goes to the state.
Like I say, I addressed it to the former director, and you know, it went nowhere. So I'm still waiting for answers.
And just kind of jumping on that same thing, many of us in the senior council also emailed all of the supervisors prior to that meeting on the 11th. I got 2 responses. One from my supervisor in the city of Norwich, Jim McNeil, because I personally know him, I think is why he responded. And he's one of the ones that wanted to push it along, apparently. He said, concerning the changes proposed, I truly believe this plan will not reduce services. The one concern I have is the nutrition aid. I feel it is needed. One way or another, I'll work to have it included in the agency. The other person that responded is Jeff Blanchard, the chairman of the Board of Supervisors, who said, we are not, underlined bold, reducing or eliminating essential services. We're focusing on assuring that services not only continue in the most consistent and impactful way, but also adjust and tailoring staff, blah, 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 blah. And he said there's been a lot of misinformation circulating out there. I really appreciate that you reached out to us to get our side of the story. So.
He actually accused us of lying.
Yep. Yes.
Yes.
Okay.
Creating a
So-
narrative online is what they said.
So there has been a lot of outreach to the supervisors, especially prior to the meeting.
Oh, and I've sent a lot of emails to all the supervisors. Nobody's responded, but it's okay, I still send it.
Still got them.
But then they said
Yes.
at the meeting, and they say, my phone was ringing off the hook and ruined my weekend, then maybe you shouldn't be where you are. Maybe you shouldn't be sitting in that position anymore.
Yeah, what really kills me too, and this is just like kind of on the aside, is, you know, I posted on Facebook for public the meeting minutes from Health and Human Services, which is where this started, subcommittee of the board. And Dr. Wanzer, who is the supervisor for North Norwich, he's the one who proposed this resolution. I don't even know who seconded it. Then it went to the Personnel Committee. And again, Wanzer was the one who proposed this resolution. He did not show up at the full board meeting.
Correct.
He knew
He was the only one absent.
He was absent. He was the only supervisor that was absent.
Oh,
And he's the one who proposed it twice, in 2 committees. I don't think he's on finance, otherwise he probably would have done it there too.
Well, what I find out is that, you know, you have the Board of Supervisors minutes, then you have all your subcommittees, and it's like going in a rabbit hole. What committee is in charge of this? Where are these minutes typed in? Because I questioned the attorney, I go, I went through all the Board of Supervisors minutes this year and last year, and I could not find this being discussed. And he goes, well, it could have been executive session to discuss personnel. So the public
That's what they did.
has no information on this.
No.
Under the scrutiny of privacy.
And any supervisor who's not on like Health and Human Services, this proposal would go through Health and Human Services, then it would go to Personnel Committee because they want to fire people. And then it goes to Finance because it does affect money. So if you're not on one of those three committees, you have no idea what was said in executive session.
Right.
They don't take meeting minutes, they don't share it with anybody else because it's executive session. So any other supervisor who's not on one of those three committees has absolutely no idea what was said.
But aren't they public employees?
Yeah, they're running for the public, but you don't want to know what's said behind closed doors.
They don't even share it with other supervisors. They're certainly not going to share it with the public.
Okay, can we go to our next speaker?
Yes, yes.
I'm going to leave these over here.
Okay, thank you. A couple of things that were brought to my attention late last night, so I have not confirmed these. A person emailed me who works for a private company that basically audits other states' agencies. They live here in Norwich, but they can't work in New York because it's a conflict of interest. They did some digging on their own, and some of the questions that they have, I'm trying to find it. The number of caseworkers in DSS, I believe, have an average. This is what they found out. I don't know. This is what I haven't confirmed. Their caseworkers have between 2.5 and 3.5 cases at any one time. The New York State suggested and average is 11 to 12 and a half cases at any one time per caseworker. Remember her numbers that the senior outreach managers carry 70 to 80.
All outreach.
All
Whether it's senior
outreach.
or just an
Okay,
outreach.
okay,
You have-
thank you.
And also
you.
remember
70.
with DSS, they close their cases.
Yes, yours
We do
remain
never
open.
close our case
Not unless
unless
you
our
go into a
clients
nursing home or
die.
you pass.
Okay.
Otherwise, it's open.
Okay,
That may not be active.
Right,
But we have it
but it's
open
open.
and we have all the history. If you call 5 years after your last appointment because something new has come up in your life. We have all the history of everything we've done for you.
wonderful. And, I just lost it. I hate it when I lose a thought. I'm sure I'll remember. The money, the Agency on Aging really helps keep people in their homes, okay? That is their primary goal. Because of that, the people they serve, any of the programs that they do that are also in Medicaid, every dollar spent in the agency saves Medicaid 5.
Wow.
Okay, so this isn't pennies, okay? And because they keep people out of the hospital, out of the emergency room, and out of the nursing homes, every dollar spent in the prevention saves Medicaid $8 in those three categories.
I believe it.
Yes. Yeah. And finally, the last thing before our last speaker is we have an above average number of seniors. It depends on where you get your data from, but it's anywhere from 28 to 35% are over the age of 60 in this county. And it's not because the young people are fleeing, it's just because we're aging out.
We are
Nobody's
the baby
moving in.
boomers. We are the baby boomers.
Right. So it isn't a matter, no one can say that, all of the young people are leaving. They're not leaving. We're not replacing the people who are dying. So that's the attrition. And because of that, we are the fourth highest elderly population in the state by county.
From the bottom in Portis.
Yes.
Yeah, we're poverty level, yeah.
Yeah, we are a little bit better than some that are equally rural, but not by much. The seniors, at least 10% of those 13,000 over 60 are below the poverty line. So that's at least 1,300 that should be getting full-time access. You're only supposed to have 25 cases per, and they want to get rid of at least 3 outreach.
3 senior outreach, and if
Yeah.
they get rid of, even just if they only 2, like the third is the New York Connects person who does not carry Facebook, but they handle people of any age. So, but you get rid of the 3 other outreach workers. I'll tell you, the outreach workers that are left, which would only be 3, there'll only be 3, because the others who outreach are New York Connects, they can't carry a caseload. So you're only gonna, so they're gonna take 3 seniors and dump that onto 3 regular outreach workers. Nobody's gonna be doing any of the reports, and they're gonna double their caseload, I'll tell you.
There won't be an agency.